I just got done sharing a webinar with Project Opioid, and I wanted to share some important messages that came out of the webinar for me. The opioid crisis has been in the background in the past year. The opioid crisis, after all, is a slow-moving mass casualty event, a slow-moving public health disaster, and COVID-19 is a fast-moving one in terms of the death rate. So there was a lot of confusion. 2018 was the first year that showed an actual reduction in the overdose death total across the United States. When you broke the data down, what we saw was that Narcan was improving things. Narcan was preventing overdoses. More people were getting access to medication-assisted treatment. So prescription opioid drug deaths were going down, and heroin drug deaths were going down. Fentanyl drug deaths were still going up, but the balance was down. That was a blip. We saw, even before the pandemic, that the 2019 numbers showed a 5% increase in overdose deaths. And if you look at the data that's coming out around the country about overdose deaths in the pandemic, you're not going to believe it. You're going to see numbers coming out of different states like 50% year-over-year overdose death increase, 60%. I was talking in Florida, the number is 70%. There are communities in the United States like Syracuse that are talking about a 95% year-over-year increase in overdose deaths. So what we are seeing is that we have an epidemic within a pandemic. And what I tried to argue in the United States of opioids is that this is not a problem that's going to get solved with Narcan. Narcan is valuable. It's important to get it out there. Medication-assisted treatment and access to it is critical, but those are only the beginning of solving this problem. This is a much bigger problem, and what we can see in the pandemic is that the underlying drivers, the issues of isolation, of despair, the parallel mental health crises, the untreated anxiety and depression, the lack of access to care for all of the trauma is making the problems so much worse. We've got to do something about it. I'm going to be sharing more ideas and an update. Really, this is a new chapter in the opioid crisis, and with the dark winter that we're expecting ahead of us with a surge, we've got to do more to put solutions on the ground quickly and to get more people involved in addressing these issues. I hope that you'll join me, and I look forward to sharing more ahead.